The Minnesota State Retiree Council has in its vision statement that retirees shall have affordable and accessible quality housing and health care. Today we're going to look at the health care, accessible health care. Joining us today is Senator Matt Klein, who is a MD, a Doctor of Internal Medicine at Hennepin Health in Minneapolis, and a state senator. So, Senator Klein, what barriers are there to healthcare in greater Minnesota, in the rural part of Minnesota?
Well, first of all, thank you so much, Dan, for giving me this opportunity to speak with your members. And there are significant and historical problems with healthcare access in rural Minnesota and greater Minnesota in particular. One of them goes to just the culture of physician training. You know, young medical residents that come out of 4 years of medical school and then a residency tend to be drawn more to urban areas. It's a little more difficult to recruit them into rural practices, particularly the high specialties like radiology and neurosurgery and some orthopedics, some of the specialties that you in particular might need in a rural area. And people have developed loan repayment programs and so forth to try to counter those incentives, but it remains an intransigent problem that we continue to struggle with. And the other is, as we strive as we should to control healthcare costs and spending statewide in Minnesota and across America, systems such as Mayo, for example, are more and more inclined to consolidate. And if they have a hospital in Albert Lea and a hospital in Austin, it's to their benefit to try to have one hospital that covers both those areas. But that does create significant barriers for people who have to have a baby at one hospital and travel 40 minutes when they used to travel 3. It's a significant impediment for them. So it's just kind of a function, a side effect of the fact that we're trying to control costs, but it does involve some limitations for people who live in greater Minnesota. You know, it's a problem that is unique to the farming population, farmers in Minnesota, is that so many of them are on the individual market. They're part of these 5% of Minnesotans who buy their own insurance up on the exchange. And those people are particularly susceptible to the high cost of health care today. They have very high premiums to cover their family. They have extremely high deductibles. And so a significant or even a modest medical event can impose a significant penalty for them. And so that's a population that's uniquely sort of part of the individual market and uniquely vulnerable to healthcare costs today. And lastly, Dan, you know, transportation in rural Minnesota remains a problem, and especially for people who most need medical care, disabled people, elderly people. It's not always easy to get in your own car and then drive 40 minutes to the local hospital or the local clinic. And we continue to work on statewide transportation infrastructure, but this is, for people in greater Minnesota, a real impediment to obtaining good health care.
So those of us who are in the metro area are very much concerned about what happens in the rest of the state. And we are all in this together, and we all need access to health care. So thank you, Senator Matt Klein.